I have made an arrangement that these practicals when we conduct at that time, uh, we make groups of students, around 3 to 4 students in a group. And what I do is, suppose it is once a week practical is there. So during that once a week practical, what I so far followed is this group is there, maybe 3 student, 4 student, as you feel. Now this is first day of practical, we suppose like this. So when this is the first day of practical, today suppose I have conducted this introductory class, okay. Now this is day 0, and then the next week will be day 7, because again it will be on 7th day this same practical will be coming. Now on day 0, once we depart, you take a case, you search it on net, you take the case, you put it on group. Now you have got your own colleagues over there. For next 2 days you discuss among you individually try to do it. You make one notebook for that. That notebook will have all the details. That is, this is the case. You may either paste it as such, or you may just write it down, or you just mention it that the case is with you. Some words, if it is too big, then just you assign some case number, something, so that whenever it is possible you can put it over there. So this is a rough notebook you are having. That is what we can call as a daily work notebook for practical. And this on this, what you do is, the individually you think on this case, what is your subjective information and objective information, and on that base what is your personal assessment, and given that personal assessment, what you will be planning. So for SOAP, you are thinking over that this is the subjective information, this is the objective information which has been given over there. On this basis, what you think, suppose it is case of maybe depression or schizophrenia, and then what can be the stage of it. On that basis, what sort of treatment is given, whether it is appropriate, what you feel in that condition, because you have referred various guidelines, you have studied the guidelines. On that basis, what is your opinion? Now this personally everybody is writing. Suppose in group there are 4 students, student A, student B, student C, student D. So A has individually thought over that, B has individually thought over that, C has individually thought over that, D has individually thought at that. This has done in first 2 days, 0 to 2. Then on 3rd day, you discuss among yourself. That is, the group is there, will discuss among yourself that what was your opinion, what do you feel from that. Suppose A felt that this should be treatment, B felt that this should be treatment, this should be dose, this should be regimen, this should be the guidances, this should be the counseling. A, B, and either it may be almost matching or it is not matching, somewhere there are differences of opinion. Everybody is writing that, and you discuss among yourself that what you feel like that. Once it is there, then you put it at the day on the day of presentation. So you take again 2 days for your internal discussion, and on 7th day you are putting this, you are compiling this a day before, all this data, and then your what you reach to a conclusion. Suppose there are 3 versions, and in that maybe 2 are having same opinion. Maybe let us assume that student B and student D are having same opinion, but A, B, that is A, B, D and C are having all 3 are having different opinion. Then you have discussion on what basis A has made this, B and D has made this, and C has made this. So on this basis you understood this, that this was the reason. You try to reach to that. If you do not reach to consensus, if you feel that everybody feels that they are correct, then we will discuss it on the day of practical. Now let me tell you that we may not find much time. Earlier we were having 3 hours practical. Now our schedule is getting hectic day by day. So we'll go for the gist of it. 1 hour we'll finish off maximum discussion on that. So if you have prepared it from the beginning, that will help you. For that, what is my practice so far is whatsoever theory has been taught, on that basis of theory we are going for practicals. So we have already finished all the psychiatric diseases. Almost we are on the verge of completion of these neurological diseases. Now we have got good scope to go ahead with the practicals. So you can start with practicals. You fix the day for practical, and during that whatsoever you feel, the topic should be declared first in the group. Maybe suppose you start with depression, then we have seen so many things. You start with depression, then there is schizophrenia, bipolar diseases, then anxiety, generalized anxiety, panic disorder, so many. So you go for that, then sleep, then one by one. So you decide that on the basis of quantum of the work. In some day, if you can take more than one problem, but if the problem is bigger, or the chances are there, example in schizophrenia we have got so many complications, we have so many drugs, and we know that in certain condition we have to change the drug. In certain condition our first line, second line drugs, they are changing. So whenever such kind of conditions are there, we can have all class is having similar set of this one, that is one topic only. However, if you feel that some of the topics are very small, one example, sleep is very small, we don't have too much into it, then in that cases we can have more than one topic in that. So you plan it accordingly on the basis of quantum, and that should help you in planning your practicals. You can start your practicals. Once you finalize this, then every group will write down the final SOP, but simultaneously they will mention in record book that what was, because even if you have committed error, that won't be deducting, or it won't make any impact on marks, because we are happy that you are applying the knowledge. It's not that who thought it correctly. And then there are some cases where answers are provided. In some cases answers may not be provided, but in some cases answers are provided. Now suppose you have made everything wrong, all the groups were wrong when we compare it with the what we can say standard, or this answer which is provided by the case. Then we match it, and then actually we want to learn that what mistake we committed and why we committed. At the same time, there are every chances that if we are thinking in a rational way, we may be correct, and that can be another version, because many times in therapeutic it is not a single path, there are multiple paths. So there are everything, only you have to compare that, yes, if you are also correct, or when you are reaching to the consensus, you are also correct, and the correct answer is there, the differences are there. So check out what is the reason for that. So as day 0 you are starting, within 2 days every individual is writing. Next 2 to 3 days you are having discussions that on what basis you are compiling at your group, why group A, why student A is having different, why student BD is having different, why C is having different opinions. I repeat, all your opinions are not based on whims of a student, they are based on the guidelines you have read. Now again, this is very important over here. That means that there are every chances that somebody has referred old guidelines, somebody has referred latest guidelines, somebody has referred Canadian guidelines, somebody has referred UK guidelines, somebody has referred Indian guidelines, so, or somebody has referred any other textbook. There are chances of variation. This simultaneously give you idea that what are the places of variations. This is helping your theory also. That means these places of theory are there. These are the places of variation that will help to identify. Then we can finalize that what should be the best option out of it. Okay. again, as I told you, then once you reach to that compilation, group A, group B, and you discuss it among yourself, then you are trying to check it with the original one and see the difference with the original, the answer which is given, or what we can say, the standard answer which is given by the question from where you have taken the case. Now, what is my aim over here is, let me tell you very clearly. I am really sorry to tell you that since beginning, when I came over here, when I joined, that was a very because clinical setup was not the case. I am basically from experimental or animal studies person. But when I thought that what can be done, and second thing is, before that I came to know, I have referred some of the journals over here. Some of the people said that those who were there here, some PharmD staff was there on this contract basis. That PharmD staff has asked them to get the cases from nearby hospitals or from the Ghati hospital and then present it. But the problem what I felt is, again, these cases where these answers are not there, then that may make confusion, because there are many reasons, there are many hidden things which are there why the decisions are taken. And I used to quote very good example for that is, I remember in first year only, I started with the Kodakimball and that was related to, I suppose, pediatric doses. Very nice case was mentioned about use of theophylline and all. So in that, what is impact is there, actually if we study it, we see it as per that, we find that our own opinion may be correct. Then when we match it with the Kodakimball's answer, then I found that some points are there which we may not have considered. Now that gives us experience, that gives us a sort of knowledge that what points we missed. Okay, so this is how we can go for. If you have any difficulties, you can ask me, and I feel that you will start it at the earliest. You make the group, you put it on group that this is a group 1, group A, B, C, D, whatsoever may be, or group 1, group 2, group 3, like that. Around 3 to 4 students in one group should be okay. And then these groups will start taking classes. Again mention it, circulate these classes. One more thing is there which I expected, which never followed, is this is now again that was a practice, or at many places in clinical places they ask student to go for a PowerPoint presentation. Here we had a problem that in laboratory where you will make a PowerPoint, how you will put it. But if it is possible for you, you can make it when laboratories will start, or those who can come over here in our this practical laboratory. We have got 5 computers, you might have seen them. You can use this and you can make the presentations over there. There is no harm. So on that basis you can make presentations if you wish. However, my concern was always about the content than the type of presentation. Means it doesn't mean whether you put it PowerPoint, you discuss it, you make it on notebook and you discuss it. My aim was always that the student should be very confident in that, why the student is or why that particular group is reached to that consensus that this should be the treatment. That means they have referred everything, they are convinced as a pharmacist that suppose tomorrow this is a hypothetical case which we are considering, but tomorrow same case is coming to the place where they are working as a clinical pharmacist. So how they will do, how they will judge. And as I told you, my experience is that, or my thinking says that our aim is not for the correct answer immediately. Our aim is to how to reach to the correct answer. What should be our thinking pattern? What should be our mentality in that? That means if I have to find a solution, I have to go for a treatment verification, then what I should see. And when these are all experiences we should get, that what the this clinical pharmacist has to see, what things he has to refer, what knowledge the person has to apply, And this is important because this is a broad science. Nobody can remember each and everything. You need to refer the things. But while referring again, I don't know whether how many of you have tried to copy during these online examinations. But again, it is not easy to do it, do the copying easily, even if it is online examination, particularly if the examiner knows that you can do it. Then those who should have very good hands-on knowledge about it, what topic, most of the things they have read, and very small confusion is there, they want to remove. In that cases, this support is helpful. Otherwise, most of the energy the patient is, suppose you all are clinical pharmacists, patient is coming, then you are going in this book, that book, etc., etc., and then the patient is waiting, then you are, it can be a very big joke rather. Okay, you are waiting, you are just trying to refer this, you are trying to refer that, you are confused, and the patient is more confused that what kind of problem the person has got, so that the pharmacist has to refer so many things. So please see that as I told you, my aim is very clear. My aim is that to make you confident about using that resources, and to come to the outcome, to reach to the outcome using that whatsoever resources you are using. My aim is again to make it to make you very acquainted with the these resources. Whatsoever resources you are using book, you are using websites for guidelines, you are using other notes or some clinical practice sites or whatsoever, how you are using and how you are reaching to conclusion. So I suppose I have guided you on this aspect of practical. If you have any difficulty, you can just let me know, and you can start practical. You just put it on group that this will be the mode of operation of practical, and accordingly we will be moving. Any difficulty anybody is having about this mode or practicals, etc., you can just ask me. Either you can unmute yourself, speak out, or you can put it on chat box. If you feel that now you don't have, but whenever it comes, you may just put it on our WhatsApp group that this was discussed, and accordingly you can put it there so that I can answer on that. So any of the way you can use. Is there any difficulty? I think it's clear.
Yes, sir.
Okay. So let me tell you one more thing is I am very much pained with the facts. Although I tried for the betterment of student these things, but this concept I have found that student has not used. Many have not used. Many have just, suppose this is the practical was there on Wednesday, I suppose. So if the practical is on Wednesday, then student will just search some case from the net on the same day, somewhere in the morning, will come. Many might have not gone through it. Many have not read the word properly, and they will start it presenting, just completing the ritual. So my sincere appeal to you that please do not resort to these practices, because that is not help you actually. It should rather harm you more, because I am making one practice that usually during examination I give hypothetical cases, and these are having some important keys, some important things. Those who understand the application of knowledge, they can do it in better way, otherwise the others cannot. So mugging up or just trying to copy from somewhere, it doesn't help. So please see that this is not happening. My aim is here, or this particularly method is adopted to sharpen your skills to identify the problem, to sharpen your skill to find the solutions for the problem, and accordingly present it in better way. So I repeat, I won't mind if you resort to malpractices. It will be only just pain I will have, that I was trying to do some good for the student, but they do not wish. Okay, it's up to you. It doesn't mean that I do not understand. Let me tell you, I understand. I point it out also. But when you are coming here for learning, I am very sure you should know how to learn, because you have paid the fees. You are spending your time, you are investing, rather I'll say, you are investing your valuable time. So I wish that you take a maximum benefit out of it. Try to follow these practices. If you feel difficulty in the practice, if you feel that it is not working as I desire, then we can discuss over it. If you follow it, then. However, still without anything, just to go away from the extra work, that is ये कौन करेगा, डे 0 को केस हम डिसाइड करना, 2 दिन इंडिविजुअली देखना, उसके बाद ग्रुप में डिस्कशन करना, इतना कौन करना है. उससे अच्छा एक दिन पहले या उस दिन सुबह मॉर्निंग में विल टेक द केस, एक दो सबको आधा पैराग्राफ बांट देंगे, 3 लाइन सबको बांट देंगे, देन विल डिस्कस दैट केस, done. So if you do this, anyway it's your choice. Okay, but for better knowledge, I repeat, I feel that if you follow this formula, it should help you more comparative to this instant mode of presenting. So with this, I think I should conclude over here. We'll start practical. You fix the day. I think timetable has arrived. We can keep the same day which has been given in practical, and there you can start with that. You make the you discuss among yourself. You make the series of topics of the cases. That is, in first week what topic, in second week what topic, and once there are there, at least after around 5 to 6 topics are covered, we may go for internal examination. So we'll plan internal examination. We'll check about what can be the mode possible for the internal examination. So take care, be safe. If you have any difficulty, as I told you, you can ask me. Okay, just let me know how you are planning for your practicals. You put it on our WhatsApp group. Okay, take care.